In the mind of a child, what does separation look like?
So there are so many dynamics that happens that's very dysregulating and fragmenting to the mind, the emotion, and also the physical brain structure of a child.
How does the body determine what to do with that memory?
And touch deprivation was felt during the
Pandemic.
pandemic. Every symptom is not a diagnosis or a mental health issue.
In
Yes.
addition to working with a professional, again, do not try this on your own.
We teach them how to
Wait a
crawl.
minute. Did you say they're infant therapists? I had no idea that that's a specialty.
Children have what's called egocentric thinking. They
Okay.
believe that everything is,
Oh, okay. You said encode the brain. Can you
yes.
expound on that? It's so fascinating. Childhood separation happens in so many instances, from divorce, relocating, incarceration, and even latchkey kids. But in many instances, we have underestimated its impact despite knowing that adverse childhood experiences are the most consistent predictor of someone's well-being during their adulthood. Today, our guest expert takes on this complex topic, leaving us with life-changing tips. We thank you so much for joining us, and don't forget to do what? Click subscribe. There's been a lot going on. And sometimes we forget about the little ones and how
Mhm.
they're experiencing a lot of the circumstances that are supposed to be adult experiences. But the truth of the matter is that kids also have experiences too. And they watch, they learn, they model, and they take in a lot of the things that they are seeing. One
Mhm.
of the most common traumatic events for children is the separation from a parent. And this we can oftentimes see as a result of divorce, relocation, and sometimes, unfortunately, forcible separation for a variety of reasons.
Mhm.
What does that separation do? What is the outcome in the long run for that child? What is that child experiencing now? How can you help the child to process the experience of being separated from one or both parents? What happens when a child is separated from their parent?
This is Jocelyn. She was an 11-year-old from Texas who took her own life after being tormented by classmates who threatened to call ICE on her family. In an interview with Univision Dallas, Jocelyn's mom said her daughter was taunted by classmates, saying they'd get ICE to abduct and separate her from her loved ones.
Whew. I got to exhale before we even start, Dr. Black. And of course, if we're going to touch on such a topic that is not talked about enough, because there are people who have been separated from their parents when they were younger, don't really talk about it. In some cases, it becomes a way of life, a matter of fact, it is normalized. And so we don't really explore much the end result of, or how that may impact the life of a person until this platform. Well, we're going to do it today. And we could not do this with none other than Dr. Black on the couch with us this evening. Dr. Black, thank you so much for joining us again, because there's a
My
lot going
pleasure.
on. We always come to your couch when there's a lot going on.
Well, thank you
Without
for
doubt.
having me. Yeah.
Without doubt, there's a lot going on. We're so thankful. We're always so enlightened when you join the couch. And this is a topic that is just so dear to my heart, because kids are just dear to my heart, period. And there's been a lot going on in our country. And unfortunately, we don't really talk about the impact of the kids. We talk about the adults and
Mhm.
how the adults are somewhat dealing with these circumstances. But, there are child labor laws being turned back, and a lot of things are happening. And one of the things I really wanted to explore is this separation of kids from their parents. For a number of reasons, we have divorce rates that have been climbing. We have families that are trying to survive economically, and so they make hard decisions to relocate and sometimes separate the family just to survive. Can you walk us through, in the mind of a child, what does separation look like?
Sure. You know, this is a very layered topic. But everyone understands what it feels like to be separated, and I'll explain. When we think about childhood separation, there are two different types. There are brief separation and prolonged. So if you can imagine the very first time that you went off to school, preschool, the very first time you were lost in a park, it's very devastating, it's very traumatic. But what we don't really give rise or attention to as much as we should is the impact on the psychological development, but also the long term development into adulthood as well. And so when a child is separated from a family member, parent, or if they're separated by divorce, if they're separated by deportation per se, if they're separated by death, or any other universal situation that happens, the child does not have language or content to actually explain or rationalize the absence. So the child fills in the blank with acting out behaviors. They don't have the language to actually say and tell you exactly what they're experiencing. So, what you will see in a child, first, what happens is it impacts the hippocampus, which is our memory center in the brain.
Mm-hmm.
So, as we understand, a child's brain is very, very vulnerable. So, those neurological connections begin to actually damage, atrophy, but also long term over time, those connections can impact the way the child thinks, the way the child sees and goes about the world. It can actually develop into personality disorders. You would see tantrums, acting out. You would see educational difficulties. But we don't really, what is very, very important to actually realize is the sense of safety that's fragmented in the.
Mm-hmm.
It's very, very important that a child understands security and safety from a very young age. And
Mm-hmm.
usually, when we skip that stage of development, we often grow up being fearful in the world. So there are so many dynamics that happens that's very dysregulating and fragmenting to the mind, the emotion, and also the physical brain structure of a child.
Wow, wow. For a parent who is trying to deal with the acute part of the separation,
Mhm.
that instant moment when the child is initially separated from the other parent, by whatever means is causing the separation. As you mentioned, sometimes they will tantrum,
Mhm.
um, have bursts of emotions,
Mhm.
as many adults do, right?
Mhm.
How do you handle the child in that acute moment?
Sure. So reassurance is very powerful. When a child is briefly separated from a parent, you're going to see the child actually move towards the caregiver, the parent, a bit more. So they may be a bit more clingy. They may want to actually keep their eyes on the parent. And that is a way for them to actually regain a sense of security and connection and reassurance with the parent. And it's okay to actually reinsure and to actually nurture the child sense of safety in that way. So you're going to see a rise in a clinginess and need. But
Mm-hmm.
over time, once the child actually has that reassurance that mommy, daddy goes away and comes back, because we want the child to actually have a healthy separation as well. But when it's
Mm-hmm.
abrupt, that's when it's dysregulated. When it's abrupt and there's no correction, when it's abrupt and there's no reunification, that's when we actually see the trauma responses, the attachment dysregulation. And
Mm-hmm.
we have different attachment styles that we all actually experience.
Mm-hmm.
So rather than a secure attachment, when there is a normal process of separating and reunification, such as a child goes to school and come back, the parent
Mm-hmm.
to the bathroom and comes back. And so that is healthy.
Uh-huh.
But when a parent is taken out of the home or by any means, how the parent is actually taken from the home and what happened breeds the context of the anxiety behind the separation as well.
Oh, so if we're talking about incarceration, for example,
Yes.
that
And
would be a different experience than someone who is taking a job in Europe and maybe going away for a while.
absolutely, absolutely. Because the child who witnesses the parent separated by arrests or even by a very unhealthy, high conflict divorce,
Mm-hmm.
that is going to actually encode the brain a bit different than a healthy separation.
Oh, okay. You said encode the brain. Can you
Yes,
expound on that?
yes. So children actually personalize because children have what's called egocentric thinking. They
Okay.
believe that everything is happening because of them
Oh,
in
yes,
the
they do.
world.
Yeah, I totally
Yes,
get that. Mm-hmm.
yes. So when that's not really corrected or there's not proper um, counsel or nurturing to help the child understand a
Mm-hmm.
healthy separation, that this was not your fault, the child then personalizes it, self blame, and that can
Mm-hmm.
turn into an array of personality disorders. The child can grow up with anxiety, eating disorders, depression.
I don't want to hold you back from your career or your aspirations.
Once I have that support, it just makes me go even harder, if that means something to you. But
It means a lot. My father like left me when I was a child, and I'm like, well, when he gets to where he needs to be, will he leave me too? Like, like I still feel abandonment because of how it was back then and there. But even though like our relationship is much better in a much better place, and I do feel like I have my father and I can call him for anything.
you're in a good space, but it still bothers you in a sense.
Yeah, when I get into situations where the person they don't want to work things out, I just instantly say, okay, I'm gonna leave them before they leave me, and I need to stop. But I still have those issues because of when I was a child. So,
I get it. My father, I didn't really know him. I probably met him like twice.
and you never.
When I was probably like 27, I wanted to reach out to him, but I found out he passed. But I carry him here.
You do. And
Unhealthy interpersonal relationships. This is where you actually see very porous boundaries, very naivete. There is no structure or security in who they are. And they believe, and in their little brains, I am bad. It's because of me. So you'll see the child either withdraw and go in. Some children shut down.
Mm-hmm.
You will also actually see, and which is very fascinating, they're going to act out their emotions through play.
That's
So,
why play therapy is so important.
absolutely.
Ah.
Yes.
Mm-hmm.
So, in play, you will see a child's play become a bit more aggressive or
Mm-hmm.
not enjoyable.
Okay.
They may have difficulty with playing with other children. They
Mm-hmm.
may socially isolate. They may draw
Mm-hmm.
figures sporadically. It's very, very interesting in what comes out in drawings and playings and what they're creating in their stories with movement objects and in their hands.
Oh, that's so interesting. So is the play sort of them mirroring their experiences? Is that what they're
Yes.
doing?
Yeah.
Um, when we talk about these sort of trauma responses, what age group are we more likely to see this in? Like at what point do they process the situation different? Is that the adolescence group, or do they still sometimes exhibit some of these behavioral patterns?
Sure. So I'll begin here. We have something called object permanence that usually happens between the ages of 4 months to 7 months.
Hmm.
That means that the infant has the capacity to actually recognize mom and understand she or he looks for mom.
Okay.
Okay, so at that age, it's very, very important that they understand absence. So, from usually the age of 2 to
Hmm.
about the age of 11, it's very, very traumatic. Once we actually get into the adolescent teenage years, they have more social connections where they can actually healthily attach to their peers. But during that age, it's very, very important that they actually have that dependency, that security, that attachment, that sense of belonging, that I can go and I can come back and mom and dad is still there.
Okay.
So, but the unfortunate circumstance is that at any age,
Hmm.
from 0 to 17 years, it can be very traumatic when you have a parent ripped out of a home or actually leave in a very abrupt way through death or divorce or other circumstances.
Hmm.
So we don't want to minimize any age, but it's absolutely more detrimental for a younger child to get help as soon as possible because the brain is more adaptable at a certain age of development.
Okay. Okay. So there is a way to, okay. So there is no too early. So an
Yeah.
infant, for example, that is taken into child protective services because mom was on drugs and there is no father, um, can have impact from that separation.
Oh, yes, absolutely. Absolutely. Because we
Interesting.
also have to remember baby has been with mom
Right.
for over 9 months.
Yeah. Right.
They know the sound of their mother's voice. They have a chemical bond to the milk, to their mother's tone of voice, to touch. So when they're separated, even though there's not cognitive awareness and functioning until the age of 4 to 7 months, the child will always remember, your unconscious mind will remember that something is missing.
Okay. Okay.
Yeah. And
Wow. That's
usually,
fascinating.
sadly, when children are taken out the home at the infancy level, they don't get a lot of touch or
Mm,
care or nurture because the system sometimes doesn't
mhm.
have adequate caregivers to actually supply the nurturing that a child needs at that age. So the absence of touch is very, very important
Mhm.
to really, really address and understand. And I'll use an example. There's something called touch deprivation, and
Oh.
touch deprivation was felt during the
Pandemic.
pandemic.
Let me tell you, I had to hug myself during the pandemic.
Yes.
I'm not even kidding
Yes.
because I realized after several months, because I isolated excessively because I take care of a vulnerable population,
Mhm.
and I realized I have not been hugged in a long time.
Yes. Yes.
Like
Yes.
it's so fascinating that
Mhm.
you take these things for granted until they're gone. And then
Yes.
you realize how important touch was to be able to shake hands with people.
Mhm. Yes. Absolutely. And we can all recall that feeling, that absence created an emotion of isolation and sadness. Now, just imagine the emotions of a child.
Right.
And when you see a child holding themselves and rocking, that's another sign of
Mm-hmm.
deprivation. So, their ability to actually trust, to
Mm-hmm.
actually attach, they have a memory that things, people don't last long. So that's when you have the avoidant attachment style.
Oh,
Yes.
that's
It's,
interesting. At
yeah.
what point can a child actually create? So the infants can experience the loss of the separation, but at what point can a child actually form memory of that separation?
Oh, a child can form memory at a very, very young age. We,
Okay.
we never really lose our memory. Our access to them are very suppressed.
Oh.
Yes. So it absolutely depends on the genetic and biology and psychology of the person.
Uh-huh.
But I've had clients that actually remembers what happened to them at the age of 2.
I'm
Now
one of
we,
them.
yeah, yes,
I'm one of them. Yeah, yeah. So
yes.
even 2 years old, you can really form solid memories. I mean, I definitely have a 2-year-old memory. So that's interesting. That's interesting to know. So
Mhm.
and then how it's maybe a little beyond this platform, but I'm going to ask. Um, how does the body determine what to do with that memory? Because you have people who have very vivid memories. So, for example, I'm one of those individuals who have lived with a 2-year-old memory, but I don't know that it's been suppressed ever. So, to my level of consciousness as an adult, I've always known that memory.
Mhm.
And then you have individuals who do not remember
Mhm.
anything,
Yeah,
even from some of the most traumatic experiences.
yes, absolutely. The easy way that I can answer that question is the
Mhm.
body always remembers.
Mm.
So I come across individuals who don't quite understand that they have somatic pain, they have anxiety in their body, and they don't know why. And it's because of a suppressed memory, for instance, something that happened at the age of 4. And it's in the office, and after they
Mhm.
actually work through and actually allow themselves to safely actually go back to that memory, because your brain will protect
Will
you.
take you there. And oh, the brain will protect you.
Yes, until you're ready to
Oh,
the
that's it. Well, how
yeah,
does the brain know what to protect you from?
yes.
Y'all
Well,
are fascinating.
yes, yes. And this is worked through very safely, I would
Yes,
say,
of course.
and
Don't try this at home, y'all. Do not
yes.
try this at
Don't
home.
try to induce any memory yourself, because the brain will conjure up false memories as well. So we have
Oh,
to
that's
be
interesting.
very, very careful that we're not
Uh-huh.
leading, that we're just allowing the memory, allowing yourself to actually go safely to
Hmm.
that emotion without fearing it. Because the brain, as soon as you feel the fear, as soon as you
Hmm.
fear the pain, as soon as you get close to it, you come right out of it and then go about your life. In session, what we do
Hmm.
is gently guide the patient based on where they are in a way to actually go back to that memory without ejecting themselves out of that emotion, so they
Okay.
can properly heal and resolve.
This is so fascinating. So for individuals, because now there are some circumstances where both parents are removed.
Mhm,
And so you have a child that's now left with a guardian, or foster person who they have no relationship with.
mhm,
No. I ain't gonna say everybody know. Okay. My childhood, thinking back, I spent some time in a group home, just dealing with family stuff.
Okay.
That was from the age of 13 till college.
Wow.
College was the end of that. Yeah.
That was a long time.
Yeah. Leaving home at such a young age did break my heart. Just felt like abandonment. That was what I dealt with. It did cause strain in the family.
Okay.
And that would be between, me and my mother.
Yeah.
And it's constant fixing, constant learning. So if anything, it's taught me that people make mistakes.
Yeah.
But also I have to be forgiving.
Mm-hmm.
I believe that I deserve to be loved, and I believe that the love is out there. It's just now is my time, and I'm going to get it.
For that foster person, how do they build trust with that child? Like how do they even approach a child that just had a separation event happen?
sure. There are many ways, but the first is
In
patient.
addition to being on your couch.
Yeah, yeah,
That's a given. In
yes,
addition to working with a professional, again, do not try this on your own.
yes, yes. It's really about, for the caregivers out there, for
Mhm.
the wonderful individuals who do adopt and do
Yes.
step in temporarily or permanently. We thank you.
Say
And
that again.
yes, because we need you. It's necessary. It takes a lot of patience and permission. If you can remember those two P's,
Mm-hmm.
patience and permission,
Permission.
we
Okay.
don't give children the respect that they need.
Mm.
We often reflect or project our own will onto children because we want that attachment. We want to bring them in as quick as possible. We want them to feel safe, but a child is not going to feel safe until they're ready to feel safe, and that's okay. So
Wow.
things like
Mm.
touch and hugs, you want to ask, do you mind if I shake your hand? You want to ask permission. You don't want to actually impress upon your own will onto a child because they're already in a very, very vulnerable state. They don't have say so. They need you. They know they need an adult. So to give them a choice as much as possible, we do want, structure. So we're not going to
Mm-hmm.
take that
Mm-hmm.
away,
Right.
but we
You're
want
not
to
having ice cream for
actually,
dinner. Mm-hmm.
yes, yes, we want to
Right.
ask permission and check
Mm-hmm.
in with the child. It's okay. They're probably not going to be open at first. It's okay. Allow them to go through their process. If they feel that you're safe, if they feel they have enough room,
Mm-hmm.
they will come to you. They will come to
Oh.
you.
You just made me think of something, but it's a biblical perspective, so I'm gonna leave that alone for y'all. And the long-term separations,
Mhm.
right?
Yes.
With or without contact. As an adult who's experienced a separation as a child, how do you even assess if you've been impacted by it? Like, how do you even recognize that? Or do you recognize? Because some people do and some people don't. Does everyone need to be aware of their traumatic outcomes? Or is it okay to continue in life if you are living in a bubble where you feel like, I'm fine?
Sure. What I would reflect, well, I'll reflect a statement first.
Hmm.
I always say that one of the greatest books that you could never read is yourself.
Is that your statement? Like, should I quote you by that? Because that's good.
Yes,
Good.
yes. So we are in a state where life is so busy and we put on these roles and personality and our true identity becomes suppressed and identified for whatever we put on,
Hmm.
how we survive. I'm
Yeah.
a student. Now I'm a professional. Now I'm a wife. Now I'm a mother. But
Right.
in these roles, there
Hmm.
are little beams of light that comes out
Hmm.
that gives a signal that we need to actually pay
You say
attention.
beams of light. I say dysfunction.
I try to be as graceful as possible. Little bitty deficits
I
that
love it.
may
You
create
are so
curiosity.
kind. Not I. Should we preemptively, as adults, evaluate if we know we had a traumatic experience as a child? Should we preemptively evaluate with a therapist about
Mhm.
whether or not our life is showing signs of that trauma? I think that's where
Sure.
I was really getting at. Like, because some people are going
Mhm.
about life and like, life is good. I'm good.
Yeah. Well, but I would say that every circumstance or experience is going to be encoded a bit different depending on the
Yeah.
situation and the person. And I'll share an interesting statistical fact as well and come back that the separation alone doesn't determine a concrete outcome of a dysfunction later on in life because you can actually implement a caregiving dynamic where it can actually make up per se from the deficits of the attachment that the parent is not no
Mm,
longer providing for the child.
okay.
So throughout life, and this is one of the fascinating things about resiliency and children, and even
Mhm.
adults at times, that you can receive your nurturing supply from other healthy adults.
Okay. Hence why
But
foster and adoption can work so well.
yes, yes. And so they may even get this from teachers. That's why that's important.
Mm.
Child therapists.
Mhm.
So any adult, your congregation, right?
Right.
Healthy atmosphere, healthy, nurturing adults can provide a child with what they need. It's not going to totally take away the memory or the wondering and the wishes that the child may think about their parents, but it will supply them towards being a healthy adult. Now, on the other hand, what I have seen in regards to the separation is personality disorders. And some of what sticks out is depression, anxiety, borderline personality disorder, sense of an entitlement, such as what's seen in narcissism.
Narcissism. Mhm.
And so we want to really, really understand what is the child acting out that may actually evolve into a more long term severe disorder, such as reactive attachment disorder, right? A child with very porous boundaries, explosive dysregulation disorder, a child that's constantly acting out and doing self harm. We want to understand that over time that may turn into borderline personality.
Mhm.
So we want to actually address or antisocial personality disorder. So the earlier you get to a child, the more healthier they will become as adults. It will increase their chances.
Wow. That's good. That's really good to know. And that's encouraging to know for
Mhm.
individuals who may be parenting a child that had some type of separation.
Mhm.
For the child that sees the more traumatic separation, who may then form fear
Mhm.
regarding, for example, if they saw their parent taken into custody.
Mhm.
Um, how do you I guess I'm about to answer my own answer, which is sit on somebody's couch. Because how do you really help someone through that type of trauma, right? Where it's not only the separation, but it's the way the separation happened, the forcible separation.
Yeah.
The stolen child, for example, who was taken by one parent. Um,
Yeah.
those type of situations can create another layer of traumatic response. Um,
Mhm.
so I'm assuming sit on somebody's couch.
Yes, it's
It's because that's complicated because it's not only just the dealing with the separation from the parent, it's now I saw the police come take my dad, or I saw,
Mhm.
my mom came and picked me up from school and then never took me back to see, or my parents got into an argument and my mom took me from my dad and we never went back. Like those types of experiences create another layer of trauma because of how forcible the separation was.
yes, absolutely. And children are always looking to make meaning.
Hmm.
So it's really about trying to understand what did the child take or how did the child interpret what was
Mhm.
happening? How does mom, how does the child see mom's vulnerability? How
Mhm.
does mom see, how does the child see the person that actually took her away? How does the child actually see adults and his or her parents' capacity to protect them?
Right.
So it's really about how does a child interpret and give them the space to actually have their own story.
Mhm.
And if the story can be changed in a more healthy way, then you help that child understand and not
Mhm.
personalize, but also gain a sense of trust in the world as well. Because what we don't want is the child to actually have a phobia
Mhm.
and a positioning against whatever happened. to the parent,
Right.
because that becomes their script, and now that becomes their defense in the world. And so it's really about creating a safe space for the child. I always recommend therapy. I'm a little biased here,
You can be
but
biased. I'm biased too. It's my profession too.
yeah, yes,
I was like, especially when you're talking about babies in the womb, I was like, oh, that's interesting. So no,
yeah.
you're right. You're right though, because again, these, like you said, you can access these memories, these experiences, and cause more dysfunction or more harm. So
Mhm.
don't oftentimes, certainly people will hesitate to treat their own wounds. Well, some of y'all do. But for the most part, people have boundaries when it comes to taking care of their medical conditions on their own, but people
Mhm.
tend to not have the same boundaries as often when it comes to the mind and the health of the mind and addressing these issues and how we see these issues. So I would definitely co-sign sit on her couch, sit on somebody's couch.
Sure.
Yeah.
If it's quality help, go towards it. And I will also recommend, because it's not widely aware, but there is, you can actually have therapy in infancy as well. And the reason why, and I'll explain because I see the curiosity.
I'm like, wait.
There are,
I was thinking the 1 year old, the 2 year old, not even the 1 year old, the 2 year old, the 3 year old, the 4 year old, but the infant?
yes,
What is the infant
yes.
learning?
So there are milestones in
Mm,
infancy as well, such as crying and cooing and crawling. So when a child is, even a baby, is actually has experienced a very traumatic situation,
mm,
sometimes their behavior actually will regress. So they're behind developmentally, and there are infant therapists where they can actually reteach them how to
wait a
crawl.
minute. Did you say they're infant therapists? I had no idea that that's a specialty.
Yes, yes, there are
What?
therapists that specialize in very tiny, tiny human beings. Yes.
What?
Mhm.
I mean, that's fascinating. I mean, I'm here for it because why not lay down the groundwork and lay it down well in infancy as opposed to waiting for someone to develop some type of maladaptive behavior and then trying to do the work later. So I'm here for that. Wow. First, I'm going to ask you overall, do you think we underestimate the impact of separation?
I do, absolutely, in many forms. And the reason why is because separation means disconnection. So anytime we think about a separation, we also have to think of what it filled in the absence. And who or whatever has filled in the absence, if it's unhealthy, it can trickle down the line of generation. So, for instance, if there's a separation in the family
Mhm.
and it's unknown, and I'll just use an example, it's unknown, and then there's a physical element that happens. Let's say someone needs a transplant,
Mhm.
and all of a sudden they have an absent parent and they don't have the information or the connection to their actually genetic history. That can cause concern
Mhm.
in regards to biological or genetic knowing. But
Right.
also, it does have an emotional impression on generational outcomes as well. So, if there's a trauma response that's never addressed, the person grows up, becomes a parent, and actually acts out the same traumatic experience unconsciously. So now the importance of bonding with the baby is not really um, at the forefront of the parent's mind, because I survived without
Mm.
being with mommy and daddy. So I can leave the child alone for long durations of time. It happens just that subtly. So that's why it's very important
Mm.
that if it disturbs any part of your life, and I will note that every symptom is not a diagnosis or a mental health issue,
Oh,
but if
say
it
that again.
every diagnosis or
Mhm.
traumatic event, because we say the traumatic T with the little t and a
Yes,
traumatic
we
T with the
do.
big
I'm
T.
guilty of it.
Yes.
You can correct me.
So
I
every
can't find
trauma
me. I
does
need
not
to
lead.
expand. I need to expound. I need to expand my vocabulary because that trauma, I need another synonym for trauma because but when you say it, it seems like everyone understands what you're saying, but you're right. We
Yes.
overuse that word.
Yes, yes, and that's another good topic.
We are overusing the word trauma. We're guilty of it.
Yes, yes. There are different type of traumas, but all of them doesn't lead to a disorder. But if it's, if it's impacting the quality of your life, your relationships, you just really want to take a deep dive within and just work through that and really discover that life can feel a bit better if you're aware of what has impacted you.
Oh, I like that. You live a much better quality life when you're self-aware. That's one quote. The other quote is, "You're the best book." Did I say that
Yes,
right?
yes.
I'm taking these
One of
quotes. If you
the,
don't claim them, I'm taking them.
yeah, one of the greatest book in the world that you can never read is yourself,
Let me
right?
get that right.
Yes.
I think that's fascinating. I mean, I definitely would say while I have witnessed many episodes of trauma, professionally and personally, many episodes of separation, I should say, professionally and personally, I don't find that many people talk about this issue. I don't find that we acknowledge that there is, outside of that immediate impact, that there are long-term impacts of trauma
Mhm,
related to acute separation or prolonged separation. And I do think we underestimate the impact, especially on the adult life, on
mhm,
the even just productivity of the person, the ability to have healthy relationships,
mhm,
and ultimately generationally, as you mentioned, and how subtle these, because the example you gave, I would never actually connect those dots, that
mhm,
someone who is um less attached to their child or offspring could be an expression of their own separation that they experience. That's really subtle. You would just think that, oh, that's just how that person is. That person is not
mhm.
necessarily the most, affectionate person, so to speak, right? We
Sure.
tend to kind of explain things away
Mhm,
without necessarily exploring them. And I think that's what, if anything, I would like to encourage people to do is, when you're getting to the point where you're trying to explain a behavior, that
mhm,
perhaps that's the signal you need to evaluate further to see whether or not it's rooted by something that was perhaps a significant event in your life.
mhm,
Because oftentimes you see people just kind of, oh, that's just how she is. Oh, she's that type of person. Even when we identify that it's not and not to say that people aren't diverse in how affectionate they are, or how,
mhm,
you know, they communicate well, or how they establish relationships. But there are definitely instances where we identify someone being truly off the curve, so to speak, for
mhm,
lack of a better word. And that perhaps those are these subtle signals, because um, taking on maladaptive behavior can be very subtle, is what I'm getting
mhm.
from what you're saying.
Sure.
It doesn't have to be the major personality disorder person who's in everybody's face and is irritable all the time. Those are the obvious ones.
Mhm,
But there are subtle changes that we can see in individuals, that, or see in ourselves,
mhm.
that may be a sign of some maladaptation. So what are some examples of like subtleties that
Mhm.
may actually be a red flag?
So isolation, crying spells, aversive to touch, mistrust, lack of boundaries, children that just go up to any adult.
Oh, that's interesting. I've seen that.
That's a huge one. Also, what we
So
see
over
is
trusting. So under trusting
over.
and over trust. Am
Yes.
I getting those
Di-
phrases right? Is there, did
dish-
I make up under trusting? But y'all know what I mean. A lack of trust and
yes.
over trusting.
Yes. Yes. Very porous boundaries, walking off with any adult or stranger. But also, we see cognitive issues, stuttering, regressive behavior.
That's
Also,
interesting. We
yeah,
underestimate stuttering so much. Stuttering
yes.
can be psychological.
Oh, yes, absolutely. Absolutely. Because it interrupts the thinking pattern. So that's why we also see thought disorders. And when children actually fall a bit behind in school, we
Mhm.
always want to be curious. And I know teachers have a big job,
Yes.
but these subtleties, if there was training, and I know there's so much on, teachers' professors' plate already,
Mhm.
but those subtle changes in grades or the lack of ability to actually retain or recall information that has to do with memory, it should be a point of curiosity if something has happened.
Right.
Yeah.
Now that's so interesting. I mean, I agree with you. I think teachers have way too much on their plates.
Mhm.
But perhaps one way in which we can systematically address these issues is perhaps if a teacher identify a behavioral change, then be able to provide access to a therapist who can then do further work to see whether or not there really is a psychological root or foundation to that behavior or that
Mhm.
behavioral change. It's
Sure.
fascinating.
Yeah.
So ultimately, we can do better. I think societally we can do better, but I thank you for just giving us the basic understanding of what separation does to an individual, potentially does to the family, does generationally, so
Mhm.
that we can be a lot more aware of these character traits, behavioral patterns, and
Mhm.
perhaps then be open to exploring more as to what these traits or patterns may be revealing.
Absolutely. And if I can actually give one point of advice also in
Mhm.
helping a child recover after separation is if you speak to them on their eye level, that
Oh,
creates more of a sense of safety because you don't want to speak over a child that has experienced any kind of trauma. It's healthy altogether for any child, but especially when a child feels very, very vulnerable. You want to get on eye level and you just want a even voice and you want to actually communicate with them and be curious, ask open-ended question, not yes or no, because that's exactly what they're going to give you, yes or no.
right.
So, and give them choice. Choice is so important because separation, you're
Mhm.
taking away a child's ability to choose whether to go or stay. And so that's why you see children actually cling a bit more, hold on to things, have really outbursts when they lose something. And this can happen all the way into adulthood. And this
Mm.
is why change sometimes for adults are very hard because they have experienced some type of abrupt separation or loss.
Put a pin there. Oh, that's interesting. That makes sense though, right?
Mhm.
That makes sense. Oh,
Sure.
that's interesting. Oh, that's good. That's good. Oh my goodness. Um, wow. I'm sorry I interrupted you because I thought that was good
Okay.
because I never would have thought about that. Like people who don't like change, don't like to let go of stuff, hoarding stuff.
Hmm.
Was we talked
Sure.
about hoarding before. Um, But it's so interesting how these subtle changes can happen and you not even be aware of it because there's somewhat still acceptable behavior. Like there's unacceptable behavior in society where people will call you out or you get in trouble on some level. But these are all acceptable behaviors in society. So you won't necessarily see the red flags that they are.
Yes, absolutely. Absolutely.
This is fascinating. Listen, Dr. Black, once again, I feel like I'm in the school of Dr. Black. But most importantly, we are all in this school and we are learning to live better, healthier lives and to recognize just really the importance of healthy childhood. I think that's what I feel like is the overall summation of this, right? The importance of a healthy childhood, even if life happens, and life will always happen, and life keeps happening, but we can do our best to really help children to the best of our ability, whether we are directly parents or part of someone's village, to be able to help children have healthier childhoods. Because as we know, we talked about ACEs before, but we're not going to get into ACE, but we know that childhood experiences are the most greatest predictor of adulthood health, mentally and physically. And so it's really important for us to really value these important pearls of wisdom so that we can become that support system if we see a child and we're welcomed into that circle with permission, because we learned the 2 P's. Wait, I forgot my second P. I promise I learned the permission P.
Yeah.
And
Patience and
please,
permission.
oh, patience and permissions. See, I'm
Yes.
working on patience. Patience, you can see patience is my struggle. I won't even remember the word. My gosh. But as we see, with permission, entering to someone's world, because you don't want to force yourself into someone's life. But if you were granted permission to do so, to really be a part of the village that will help them to foster a healthier life, starting
Sure.
from the earliest of age. Now we know infants can go to the therapist, y'all. We learned a lot. Dr. Black, if they want to continue to learn from you and be in the school of Black, how can we follow you? How can we learn?
Yeah, sure. If you would like resources or have any questions, you can contact me on my website at drtamalapractice.com.
That is fantastic. And I am Dr. T, the hand behind the handle of Healthy Bump Club, right here on YouTube and on Fanbase, because we support our own. And as always, you can find us as well on healthybump.club on Instagram. We thank you guys for watching. We hope this helps. I know I feel like I've learned so much, but in such an incredible way where I feel like more empowered that I can help people, my patients in my personal life, all of the above. So thank you so much from a personal perspective, Dr. Black, for just enlightening me on this very important topic. So if you want to learn even more from Dr. Black on our previous topics, make sure you check out the links to this video, and we hope to see you guys when the next episode. This is Dr. T. Just a friendly reminder, don't forget to comment, like, and share. And go ahead, why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.